Assalamu alaikum. Today's article is titled Full Bulbotomy versus Root Canal Therapy in Mature Teeth with Irreversible Bulbitis. It's a randomized controlled trial conducted by a Chinese group and published in BMC Oral Health in 2024. Irreversible bulbitis caused by carious bulb exposure is a common infectious disease of dental bulb, and for many years the tooth with irreversible bulbitis has traditionally been managed with root canal therapy. However, attention has shifted towards a more conservative biological alternative such as VitalBulb therapy, and this study aimed to compare the clinical and radiographic outcome of full bulbotomy and root canal treatment in mature molar teeth with irreversible bulbitis to compare the pain intensity and reduction and to evaluate the time and cost after both treatment procedures. It is a single-blinded, single-center, randomized controlled trial. The inclusion criteria were molar teeth with deep caries exposing the VitalBulb, molar teeth with history of spontaneous radiating pain indicated irreversible bulbitis, and the pain triggered by hot, cold fluids lasted for several minutes, molar teeth with no prominent radiolucency at the periapical or furcation regions, and the exclusion criteria were the following: teeth with continuous bleeding, uncontrolled bleeding after full bulbotomy with 10 minutes, or invisible bleeding from one or more of the orifices. Teeth could not be restored with direct restoration, and teeth with internal external root resorption, and teeth with bulb chamber or canal calcifications. They had 160 patients were included and distributed equally between the two treatment groups. The patients were examined and treated by an endodontist. The teeth were anesthetized, isolated under rubber dam, then carious lesions were removed, and upon bulb exposure, the cavity was rinsed with 2.5 sodium hypochlorite, and at this point, a research assistant not involved in the assessment and recruitment of the patient selected one envelope from among the 160 sealed envelopes, which is designated for full bulbotomy or root canal treatment group. For the full bulbotomy procedure, the treatment was done using iRoot BP Plus, which is a pre-mixed bioceramic BC putty, and for the root canal treatment, it was done in 2 visits. Then the patients were recalled for clinical and radiographic examination at 3, 6, and 12 months. Radiographically, full bulbotomy was considered successful if there was no root resorption or focal bone loss, periapical index of less than or equal to 1, and for the root canal treatment, the case was considered successful if there was a normal periapical area with no lesion or a periapical index of less than 3 and no root resorption. As for the pain intensity, it was measured using the 11-point numeric rating scale. The investigators recorded the pre-operative and post-operative pain intensity every 24 hours until the 7 days after the first visit by contacting the patients on the phone. As for the time and cost of treatment, it were recorded by one nurse, and the bulb sensibility test in the full bulbotomy group was done at 3, 6, and 12-month post-treatment by EPT. Their results showed that pain levels decreased over time from day 1 to day 7 postoperatively in both groups. The average pain intensity in the full bulbotomy group was larger reduction than root canal treatment group, but at day 1 there was significant difference. And for the treatment outcome, at 12-month follow-up, the recall rate in the full bulbotomy group was 93.7%, with 2 failures that needed root canal treatment. 73 of 75 teeth were successful clinically and 70 teeth were successful radiographically, with a percentage of 97.3% and 93.3% respectively. And in the root canal treatment group, 6 patients did not come to the recalls. The recall rate was 92.5%, with 1 failure that needed extraction. And 73 of 74 teeth were successful clinically and 70 teeth were successful radiographically, with a percentage of 98.6% and 94.6% respectively. And radiographically, 3 cases failed because of periapical lesion enlarged, a new lesion developed, and 1 case root fractures. As for the bulb sensibility test, in the full bulbotomy group, there were 5, 3 and 3 unresponsive teeth with EBT at 3, 6, and 12-month follow-ups respectively. And for the comparison of treatment time and cost, it showed that the treatment time spans were 43.5 minutes and 112 minutes in the full bulbotomy and root canal treatment groups respectively. As for the cost, the average cost of molars were higher for the root canal treatment than the full bulbotomy procedure. Although this study has a major limitation of a short follow-up period, it can be concluded that full bulbotomy has a good short-term outcome when treating the mature molar teeth with irreversible bulbitis, which can effectively reduce postoperative pain, treatment time, and cost. The full bulbotomy procedure may serve as an appropriate alternative for root canal treatment in mature teeth with irreversible bulbitis.